Imagine your eye as a perfectly round basketball. The tough white wall called the sclera keeps everything inside under the right pressure and shape so you can see clearly. Now imagine a weak spot in that wall that starts to thin, stretch, and bulge outward like a worn patch on the ball. That bulge is what eye doctors call a staphyloma. Welcome to Eye Conditions Explained, where everything is drawn out step by step so it is easy to follow. In this lesson you are going to learn what a staphyloma is, the difference between posterior, anterior, and scleral staphyloma, what symptoms to watch for, and how eye doctors usually diagnose and manage it. A staphyloma is a localized outpouching or bulge of the wall of the eye. The strong white coat of the eye, the sclera, becomes thin and stretched. Because the inner pigmented layer of the eye pushes outward against the thin spot, the area looks dark and bulging. In simple terms, the wall of the eye weakens in one area and balloons outward. This is not just a cosmetic issue. The shape of the eye is critical for clear vision. When part of the wall bulges, it can distort the way light focuses on the retina, the light-sensing tissue at the back of the eye, and can lead to serious complications such as scarring, bleeding, or even retinal detachment. Posterior staphyloma forms at the back of the eye, near the macula and the optic nerve. It is strongly linked with pathologic myopia, which is very high nearsightedness, where the eyeball has grown too long from front to back. In these eyes, the sclera at the back becomes especially thin, and the curvature of the back of the eye increases locally, creating a pouch. Posterior staphyloma is considered a hallmark of pathologic myopia. It is one of the key features that helps eye doctors separate simple nearsightedness from the more dangerous form that can truly threaten vision. People with posterior staphyloma are at higher risk of problems like chorioretinal atrophy, myopic macular degeneration, and fragile new blood vessels that can leak or bleed. In everyday language, the back of the eye stretches too much and the sensitive seeing area starts to wear out. Anterior scleral staphyloma happens toward the front of the eye, usually near the white area right next to the cornea, the clear window of the eye. It is less common than the posterior type, but can be very dramatic because it creates a visible dark bulge in the white of the eye. The front sclera can thin for several reasons. These include blunt trauma, old surgical scars, long-standing uncontrolled glaucoma, severe inflammation of the white of the eye called scleritis, some congenital conditions present from birth, and in some cases very high myopia. When that thin sclera is pushed outward by the normal eye pressure, the dark uveal tissue underneath shows through as a brown or bluish-black bulge. The term scleral staphyloma is often used in a more general way for any staphyloma that is mainly due to thinning of the sclera itself, whether it sits in the front or back of the eye. The exact location matters because it changes both how it looks and how it is treated. Many people with posterior staphyloma do not notice anything at first. Over time, they may develop increasing nearsightedness, distorted or wavy central vision, or trouble reading fine print even with strong glasses. They may see blurry spots, straight lines that look bent, or areas of missing vision if scarring or bleeding occurs at the macula. Anterior or scleral staphylomas can be easier to see from the outside. You might notice a dark bulge on the white of the eye, a change in eyelid position because the bulge pushes the lid forward, redness, or discomfort. If the eye pressure is high or if there is associated inflammation, the eye can become painful or very sensitive to light. In advanced cases, that area of the eye wall is fragile and at risk of rupture from even minor trauma. Diagnosis usually starts with a detailed eye exam by an optometrist or ophthalmologist. They will check your glasses prescription, measure eye pressure, and carefully look at the front and back of your eye under the microscope and with bright light. To really understand a staphyloma, doctors use imaging. At the back of the eye they may use wide-field photography, optical coherence tomography, often shortened to OCT, and sometimes ultrasound or magnetic resonance imaging to see the exact shape of the back wall of the eye. For anterior or scleral staphyloma, slit lamp photos and ultrasound can show how deep the thinning and bulging go. These images help separate simple high myopia from pathologic myopia with posterior staphyloma, which has a much higher risk of vision loss. There is no eye drop that can magically thicken the sclera again. Treatment is focused on protecting the eye, improving vision as much as possible, and handling complications early. For posterior staphyloma, this can mean strong glasses, custom contact lenses, low vision aids, and close monitoring by a retina specialist for signs of bleeding, scarring, or traction on the retina. In selected cases, surgical procedures like vitrectomy or posterior scleral reinforcement may be considered, although these are complex and not routine. For anterior and scleral staphylomas, protecting the weakened eye wall is critical. Doctors may recommend constant use of protective glasses, control of eye pressure, and treatment of any underlying inflammation. In cases where the bulge is large, painful, or cosmetically very troubling, surgeons can perform reconstructive procedures to remove the thinned area and reinforce it with healthy tissue. If the eye is already blind and very painful, some patients choose surgery to remove the eye and replace it with an implant to improve comfort and appearance. The most important takeaway is this: if you or your child has very high myopia or a visible bulge on the white of the eye, regular comprehensive eye exams are not optional. They are your best insurance policy to catch staphyloma early and protect vision over the long term. If this video helped you understand the topic more clearly, consider sharing it with someone who has strong glasses or is worried about their eye health.